Okay, when you're taking a blood pressure at rest, you need to make sure your patient's been sitting down for at least 5 minutes with legs uncrossed, relaxing. You need to locate the brachial pulse, which is between the bicep and the tricep muscle at the anterior fossa, which is here. Once you locate that, you can place your cuff. Actually, on your cuff, it's actually tell you artery. Wherever you can feel the pulse, you place that over it.
Cuff pressure should be released at about 2 millimeters of mercury per second.
114/78. The blood pressure is within the normal range.
Exercise should be highly recommended for all blood pressure categories.
Now I'm going to take your pulse. There are 3 sites where we can take the pulse. We have the carotid, the brachial, and the radial. When you're taking the pulse, once you locate the pulse, if it's regular, you can just take it for 30 seconds, multiply that by 2. So when you multiply by 2, that's 60. She's within the normal range, and the beat of the pulse was regular.
With my buddy James here, we will now assess Dr. McGarry's BMI. BMI, or body mass index, is associated with a number of health conditions such as cardiovascular disease, metabolic syndrome, and so on. Enjoy! Leslie will now have Dr. McGarry remove his shoes and stand under the stadiometer with his feet against the wall. BMI fails to distinguish between fat-free mass and lean mass, or body composition. This is one of the major setbacks of BMI. Because of Dr. McGarry's past as Mr. Southeastern, BMI is not a good predictor of his health condition. This is why we will next take skin fold measurements. BMI is found by dividing weight in kilograms by height in meters squared. McGarry's height was 1.69 meters and weight was 77 kilograms, giving him a BMI of 26.9 in the overweight category.
Alright, today I'm joined by my friend James, and we're going to discuss some skin fold measurements and why they're taken. But first off, let's just let you guys know what skin fold measurements are and why they're taken, what they measure. James, you got any insight on that for me?
Well, Josh, the principle behind this technique is the amount of subcutaneous fat is proportional to the total amount of body fat.
Yeah, that makes a lot of sense. I understand why we do the measurement now. Thanks. Well, how accurate is it, James?
Well, the accuracy of predicting percent fat from skin folds is approximately 3.5%, assuming that appropriate techniques and equations have been used.
Yeah, I think we can assume that we'll have proper technique. I mean, come on. But, alright, well, in this next part, we're going to evaluate Dr. McGarry, and we're going to take some skin fold measurements on him and show you guys just some evaluations of that.
The chest, abdomen, and thigh. The chest site is done midway between the nipple and the anterior axillary line. The abdomen site is located 2 centimeters to the right of the umbilicus. And the thigh skin fold is on the anterior midline of the thigh, midway between the proximal border of the patella and the inguinal crease.
And for this, we're going to have your leg in slight flexion. now that we have all the measurements and the 3 sites located, we're going to go through and take an actual skin fold measurement. And what we're going to do is, when we're doing this, we're going to hold it in our right hand and pinch with the left above so we can read the scale at all times. So for this first chest pinch, we're going to have a diagonal pinch like this, and you're going to grab, and that gave us a reading of 9 millimeters. And for the abdomen, it's going to be a vertical pinch. We're going to go right under. It's going to be 14 millimeters. See the thigh? A vertical pinch. It's going to be 12 millimeters.
For the male 3-site formula, take the sum of chest, abdomen, and thigh measurements, then take age and input into body density formula. This gave us body density of 1.07. Input this into percent body fat to give us 12.6%.
Today I'm with my buddy James here. Body fat distribution is an important predictor of the overall health risk related to obesity. You normally take those by waist circumference. One of the main things when you're worried about body fat is android obesity. James, can you give us a little background on android obesity?
Well, yeah, you know, it's fat on the trunk. It increases hypertension, metabolic syndrome, type 2 diabetes, dyslipidemia, CAD, and premature death.
Thanks for that. Well, how accurate are those measurements?
Well, it just so happens as an epidemiologist, I care about the numbers. It's about 2.5 to 4% accurate when looking at the actual body composition.
Awesome. Well, I guess now we're going to show you how to go through some of these body circumferences and how to measure them. Thanks, James. Pound it. Today we're going to be doing some circumference measurements. If we could have Andrew, can you assume the anatomical position? As you can see, he's in correct form, standing straight, arms are at his sides, and feet are together. To take the waist circumference, you want to measure from the navel, just the narrowest part from the navel to the xiphoid process with a soft, spring-loaded tape measure. Just about 31. That's great. Next we're going to be doing the hip. For the hips, you want to do it at the largest point, just above the iliac crest, and just about the same measurements. With your feet on this one, you want to have them about 10 centimeters apart, just like Andrew has. Perfect. Next, we're going to be taking the thigh circumference. First of all, we want him to be relaxed, his thigh relaxed. So can you put your foot on top of your toe, there. And the way you measure this is you take it at the proximal thigh just below the gluteal crease. So if you could... That's great. Now that we're finished with all the girth measurements, we're going to go on and relate those to some of the formulas related to obesity. How do we do, James?
Girth measurements can be used to estimate body composition as well as health risks. Waist to hip ratio is often used to assess health risk as well as simply waist measurement. These measures are often used in conjunction with BMI. New research is showing that waist to thigh is an even better predictor of health risk.
James, come on, you're killing me, man. That concludes our video on anthropometric measurements. James is cracking me up over here, I'm sorry. But we showed you height, weight, circumferences, skin folds to use measure body composition, and we also threw in blood pressure and heart rate just for you guys. But from James and I here, thanks.